Alright, so the physical agent that I want to use to help Carl with his pain modulation is a cold pack. And I want to use a cold pack because it will increase the pain threshold by instigating local anesthesia. It will start the gate mechanism. It will slow the nerve velocities. It will reduce spasms and reduce edema. The parameters that I will use for using the cold pack is get it from a 10 to 20 degree unit. I will put the ice pack in a pillowcase and then have like a towel as a barrier between the skin and the ice or the cold pack. And then I'll use it for 15 minutes and make sure the patient gets to that numb feeling. I will check on the patient every like 5 minutes to make sure they're comfortable and that their skin is not reacting. The patient will be in a supine position with their left lower extremity propped up or elevated, and then the knee is in extension. And some precautions that I want to assess before are his cognition and communication abilities to make sure he can tell me what he's feeling, and then as well as check his blood pressure because his history of hypertension, and then I also like pre-check his skin for rashes or any burns. Do you have any questions before I begin? All right. So, Carl, I think that you would benefit from using a cold pack today to help manage your pain around your knee. And basically what a cold pack will do is it will help slow down the nerves that are bringing the pain into the area, and it will kind of give you like that numbing feeling, and you should have a little bit of reduction in your pain. Before we use the ice pack, I just want to ask you a few clarifying questions to make sure you're a good candidate for using a cold pack. First, have you ever had frostbite? How's your tolerance to cold? And do you have any conditions related to cold temperatures, such as like anesthesia in the area, peripheral vascular disease in the area, Raynaud's disease, over-regenerating peripheral nerve, or any condition that makes your blood react abnormally to cold temperatures? All right, perfect. So it sounds like you would be good to use a cold pack. And so for this modality, I am going to lay you on your back and I am going to prop up your left foot, and then I'm going to put the cold pack around your knee, and we'll keep it there for about 15 minutes. And during those 15 minutes, you can just relax. And what you should feel is like it get really cold, and then it might be burning, then a little achy, and then numb. So if you're feeling those, that's completely normal. But if it gets unbearable, here's this little bell. And if you get too uncomfortable, you can just ring this bell and I will be right over to help you. And if you have any questions, you can also ring the bell. And I'll keep circling around about every 5 minutes to check on you and check on your skin. So is it okay if I pull up your pants leg to expose the knee area? And I will also need to view and place my hands around your knee to assess the area before we begin. Is that okay? And then do you have any questions before we proceed? Okay. Are you ready to start? Let's do it.